quite unfortunate. As we all know, the doctors, the major workforce is made up of the Nigerian Association of Resident Doctors. They form more than 80% of the workforce in the health sector. The less than 20% that will be on ground, definitely it will be a challenge for them. And I would like to remind us that the Nigerian Association of Resident Doctors is not always interested in going on strike, but it happens to be the only language that the federal government understands. As I said earlier on, the strike of June was not carried out completely because the Nigerian Association of Resident Doctors had the interest of the Nigerians. That was why it kept some of its members, especially those that were working in the coronavirus isolation ward. The doctors decided to keep those ones on ground so that they can give necessary services to the patients, the coronavirus patients that were on admission. And that's to tell you that we don't really want this strike to go on. But it's so unfortunate that as I speak to you, those doctors that are directly working in their isolation unit are not even paid. So that tells you the kind of attention the government is giving to this very pandemic that we're facing, and then the health workers that are working in this very unit. The Nigerian Association of Resident Doctors, Taraba State Chapter, to be precise, those working with the Federal Medical Center, Jalingo, have joined the strike as of 8 a.m. this morning. However, the consultants will be on ground to render skeletal services to the populace. Those that will be needing some form of health services can go to the hospital. There are consultants on ground to render medical services to those in need of it. As some of us are already aware, in June this very year, NARD, that is the Nigerian Association of Resident Doctors, declared a warning strike. And the reasons for that very strike were clearly stated to the federal government and the Nigerians and the whole world to know the reasons why doctors were embarking on that very strike. And some of the reasons were the issue of life insurance policy. As we all know, the whole world is currently facing a global crisis, that is the COVID-19 disease, which was first noticed in China last year, but the first case in Nigeria was recorded in February 2020. And as we all know, the COVID-19 came with a lot of complications. And as I speak to you, as of August 2020, about 1,000 doctors, aside nurses, pharmacists, and other healthcare workers were exposed to the coronavirus. Out of these 1,000, about 321 were confirmed positive, and about 68 out of these 321 confirmed cases recovered and were discharged. It's so unfortunate that we lost about 14 doctors to this very disease. And it is logical to assume that the federal government will pay some form of compensation to the families of these fallen heroes. That is where the issue of life insurance policy comes in. It's unfortunate that the federal government of this very country has not met that demand. The families of the fallen heroes are just left to their fate. It's quite unfortunate. This is one of the reasons why doctors went on strike, and it's still one of the major reasons why doctors are proceeding on strike today, 7th September 2020. Another reason for the strike is the issue of COVID-19 inducement allowance. As we all know, all over the world, the government are encouraging their healthcare workers by giving them some form of appreciation money just to to appreciate them for the sacrifices they are making and the risks they are taking in order to safeguard the health care of its populace. The Nigerian government promised to do that. In June, it started payment, and when the Nigerian Association of Resident Doctors saw that and decided to suspend the strike, the federal government stopped the payment. So it's one of the reasons why doctors are embarking on strike today, because the government withdrew back its promises. It started paying and then decided to stop. And another reason for the strike is the issue of Medical Residency Training Act, the implementation of that very law. It's a law enacted by the National Assembly on how to train all medical doctors that intend to specialize in one area or the other. The act or the law specifies how a medical doctor will start the training, the level he will be, and how long he's supposed to last in the training before becoming a specialist in whatever area he so chooses to specialize in. It will interest you to know that the cost implication for this very training of a particular doctor runs in millions, and it's quite huge, and it's based on that the federal government had an agreement to support these doctors in their training, so that this issue of medical tourism, going out for medical services in other countries, will stop when we can train our own and still retain and keep our own within the country. So the federal government signed into law this Medical Residency Training Act, which, as I speak to you, has not even been implemented. The problem is we have so many good laws, but the implementation has always been the challenge. So the Nigerian Association of Resident Doctors is calling on the government to not just make laws, but to execute them and implement them. Once, I believe, this Medical Residency Training Act is implemented, this strike and will be suspended. Not just the medical residency. When the major issues highlighted are met by the government, this strike will be suspended.